Let's head on out to Mary right now for Ask the Expert about diabetes.
Yeah, any questions you have about diabetes, you might not even know anything about it, but the experts are here to answer your questions today. And we have Dr. Liz Joy here. I guess explain what diabetes is. I mean, there's insulin. What all is involved with diabetes? What does it do to your body?
Well, there are two main types of diabetes. There's a type 1 diabetes, which is typically the diabetes that occurs during childhood.
Right.
And these are people whose pancreas does not make insulin. And without insulin, you can't push glucose into your cells for glucose to work. It's magic in our bodies.
Right.
Most people have type 2 diabetes. Type 2 diabetes is the type that occurs in people who tend to be overweight or obese. And actually, type 2 diabetes represents about 90 to 95% of diabetes in the United States.
Wow. And that's the one that you can kind of control if you catch it early.
Yes, not only can you control it, but you can prevent it.
Okay.
And that's the real key message here today. And that is that diabetes is not an inevitable progression over time. In people who we identify pre-diabetes, or kind of that early stage of glucose intolerance, we call it, if you intervene with healthy lifestyle, with healthy diet, adequate physical activity, you can prevent diabetes very effectively.
Okay, and who's more at risk?
Well, people who are at greatest risk are those who are overweight or obese. There are some racial and ethnic groups, such as Latino Americans, other ethnic groups that tend to be heavier.
What about family history?
Family history is another important risk factor.
Okay, so it's easy to get tested for diabetes.
Yes, so we actually recommend that all adults 45 years of age and older are screened for prediabetes every 3 years.
Every 3 years, okay.
Every 3 years. And for adults between 18 and 44, who have a body mass index that's greater than 25, so it puts them in that overweight category. If they have just one additional risk factor, we also recommend that they get screened every 3 years.
Over 18.
Over 18. BMI greater than 25 plus one risk factor. So, for example, family history would be a risk factor.
Right.
Having high blood pressure or high cholesterol.
But it is treatable. I mean, there are medications and treatments available. If you know you have it, there are things you can do to turn it around.
Absolutely. I mean, if we identify people who have that kind of pre-diabetic state and we intervene with a diabetes prevention plan and or medications, we can successfully prevent diabetes.
Okay. Numbers on your screen all day. These folks are here to answer your questions for free.